so we're going to talk about elevated ribs and depressed ribs in relation to strain, counterstrain, tender points. We'll demonstrate on the skeleton here examples of what a depressed rib versus an elevated rib. Let's just take, for example, any one of the ribs 3 through 6 on this left side. An elevated rib would be a rib that moves upward in this position. Depressed rib is a rib that is being pulled down into this position. And a rib torsion is actually a combination of an anterior rib dysfunction and a posterior rib dysfunction, which would be an angled rib in this direction, where it's depressed in the front and elevated in the back. So you have elevated ribs, depressed ribs, and rib torsions. The tender points, the strain, counterstrain tender points for the anterior ribs are along, and the ones that we're going to be talking about specifically right now are rib angles, the anterior rib angles for ribs 3 through 6, and they're always on the anterior aspect of these anterior rib angles. So depressed rib tender points are always on the anterior rib angle of the ribs in question, and the tender points, the posterior rib tender points are always elevated rib dysfunctions, and those are located on the posterior rib angles of ribs 3 through 6. Those are the ones that we're specifically dealing with. So if you look at a strain counterstrain wall chart that has tender points, the tender points for the elevated ribs that we're looking at the right side here are on the posterior rib angles, ribs 3 through 6, and the tender points for the depressed ribs are on the anterior rib angles of ribs 3 through 6. And I'm going to show you one position that can be used to treat depressed ribs on one side, and the position I'll show you will be for depressed ribs on the right. That can also be used to treat elevated ribs on the left. Okay, so we'll show that position now. Annie's going to help me here. Sit up on the table, and if you can put just this foot under your right thigh, so you're kind of sitting on that angle, and raise you up a little bit. So what we want to accomplish here is we're going to be treating depressed ribs on the right and or elevated ribs on the left. Sometimes you'll see that in combination with patients, that they'll have depressed ribs on one side and elevated ribs on the other. So we're going to elevate the left side and depress the right side further. Okay, and Manny doesn't have many elevated ribs here on the left side, but we're going to go ahead and pretend as if we were treating this elevated rib on the left side. So we'll just pick a rib 3 or 4 rib angle on this side, and we want to make sure that the patient's arm ends up going on the pillow on top of your shoulder with your head behind the patient. Okay, much less invasive from the patient's point of view. So go ahead and put your arm up on here. I'm going to use my left hand to control Annie's right shoulder. We'll put your hand behind your back. So Annie put her right hand behind her back. I can control side bending this way by standing up and down. So I can get up and down and change how much elevation there is on these ribs on this left hand side, and then depress that right shoulder down further and get a little bit of rotation away. So for the elevated ribs on the left side here, I'm elevating the ribs further and I'm rotating away from the tender point side and side bending away. So it's left side posterior elevated ribs. I'm elevating Annie's left shoulder so that I can side bend her body more to the right, so that's right side bending away from the tender point side, and I'm rotating away from the tender point side. If we were treating anterior rib angles or depressed ribs on the right side, I would be depressing that rib or side bending towards and rotating towards that tender point side because it's right rotation. That one position then can be used to treat posterior ribs on the left anterior ribs on the right. So elevated ribs on the left or depressed ribs on the right, and you would just do the opposite position for posterior right elevated ribs and anterior left depressed ribs. So hopefully that'll explain it to you, and you can keep running it through so that you can see that that's that one position that can be used to treat all those elevated and depressed ribs.